Okay, I've had Mohs surgery to remove a basal cell carcinoma from my nose, which is a weird story in itself because all I had was a little flaky skin, and it just like sunburned flaky, and after that stopped flaking a couple months later, it became like a little pimple that popped and wouldn't heal. Little teeny red scab, tiny. And it just stayed that way for about 10 months. And I just thought because of where it was and the fact that I didn't blow my nose all the time because of my allergies, I honestly thought it was just something that was a long time healing because I'm diabetic. I would go to sleep at night and wake up and it'd be stuck to my pillow and it would rip off, and it just wasn't healing until about 3 weeks ago. And it started getting bigger and juicy, and it started getting really deep. I saw two different doctors about it, and they both said to me, and I quote, "It's nothing to worry about. Just quit playing with it." I didn't play with it. I don't want something open wound on my face. I know my face doesn't look so great right now, but I'm kind of cute when I'm done up. No, I don't play with stuff like that. So I went to the third doctor at the same clinic, and immediately he said, "I don't mean to scare you, but it looks like you have cancer. But it looks like the type of cancer that is benign, and I'm going to make an appointment with you for the dermatologist." 2 days later, I was at the dermatologist's office, and he said, "You have basal cell carcinoma." And didn't even do a biopsy, just made an appointment for me immediately to have what's called Mohs surgery. And the idea of Mohs surgery is to take what they think is the cancer, all the cancer they see, and then test the edges of that in the lab while you wait, and then come back and remove more skin, if there's any cancer at all, until they have all the cancer. But the point is to leave as much tissue as possible. Okay, so I'm good for that. So this little teeny pimple on my face, and I'm going to get this bandage off, and it's going to freak people out. Turned out to be quite a lot. This is about 5 days old, and I'm having reconstructive surgery tomorrow to get rid of it. Oh, God, it's really attached to my skin. But this is taking as little tissue as possible. That is what I'm dealing with. I have no nose. And they're going to take cartilage from my ear and cut a flap down my forehead, turn it around, and attach it here. And it will stay like that for 6 to 8 weeks while the skin heals over this cavity and creates its own blood flow, so it's living tissue. And then later they will go back and cut the flap, shape the nose, and stitch this up. Okay, that's great and wonderful. And I'm very grateful. I'm cancer-free. But I gotta tell you, the surgery, the Mohs surgery that you're awake for, and I know you don't feel anything because you're numbed up, but you can tell as they're cutting. They're using scissors. Oh, now they're using a blade. Oop, now I feel a razor. And the tug as they cut and pull and dig and scoop. And it's traumatic. very traumatic. But it gets rid of the cancer. And if you have to get cancer, they always say this, that's the cancer to get. It's the most common cancer there is. It is caused exclusively by sunlight. I'm photosensitive. I can't be in the sun. So this must stem from when I was 15, sitting on the beach in Chicago with a bottle of baby oil filled with iodine, slathering it on, trying to get beautiful at 15. Unbelievable. Anyway, I recommend sunscreen and a big hat. And don't go outside if you can help it. But the surgery was... I was shaking. I was crying but trying to be still so they didn't accidentally take more than was supposed to. The sounds, and that's what I was worried most about before I went in, was the sound of the cutting and the smell. And the waiting 40 minutes between each time they did it to check the edges and see if they were cancer-free. God, I look awful. Anyway, it's not easy. And tomorrow I have to go get the flap to cover this, and I'm just... I'm traumatized. I just don't even know how I'm going to handle it. But I'm not walking around with this for the rest of my life. And this is really healed compared to what it looked like before. You could see the cartilage, and this is kind of scabbed over a bit. So, a little flaking, just a little flaking, like dry skin, like we all get. Oh, look, I got dry skin. Oh, gee, my elbow, dry skin, you know? Who'd have thought? Now I'm all swollen up and yellow and brown and scared. Do you know that I have to wear that skin flap? And I want you to look it up. It's called forehead to nose flap, where they cut like this and turn it over, stick it on your nose. I have to be like that for 8 weeks. Not going to be going out much, that's for sure. And this happens right after I overprocess my hair and have to shave my head. And that right after I had to have all my teeth pulled. So I'm thinking, I'm bald. I don't have any teeth. I got this disfigured nose. I think I'm going to get an eye patch and just become a whole new creature. Because that's what it feels like. Don't let anybody fool you, even though you can't feel physically what's going on when they give you Mohs surgery. You can tell what's going on when they give you Mohs surgery. And it's not easy. They gave me Valium because when I was at the dentist having my teeth pulled, and he bent down and he asked me, "Are you doing okay?" I saw in his hand a toenail clipper, one of those scissor kind. And I said, "Oh, I'm doing fine," because I had things hanging. And he came in like this with it. Let me tell you something. And I had no idea I was going to do it. I snatched his wrist like it was stone arm, and I couldn't let go. He wasn't going to cut on me like that. I could tell. And I, in all fairness, told the doctor this. I don't want anyone around me, this area and up, with any sharp objects. It's been a fear of mine all my life. Throat slitting. Oh, God, I can't even see those cop shows where somebody puts a knife against somebody's neck and says, "Don't move or I'll kill her." It throws me into a straight panic. And they're slicing on me with razors and scissors, cutting. You can tell. I don't care if you can't feel it. You can feel it. It's not painful, but you can feel it here and in here. and in here. It's not easy. But the payoff is I'm cancer-free. And I thank President Obama for putting out that health care, because it's covering this. And for all of you out there who really hate Obama's health care and how you have to pay for everything, well, it's people like me that you're helping. This would be my lot if it weren't for that health insurance. So, whatever you do, do not watch videos of operations of the Mohs surgery. It'll just wig you out too much. Just go get it done. You won't feel any pain. But if you're sensitive, all you just know what's going on. And the nose flap is tomorrow. That you should look up. Not the procedure, but what it looks like, should they say you need it. I'm not really sure what else to say, except that I used to be pretty. Hard to tell right now. But I'm going to keep you up to date, and I'm going to get pretty again. God bless every one of you. And I pray for any of you that has Mohs surgery or carcinoma of any sort. Bye-bye.